Good afternoon, Prime Minister Trudeau. We appreciate you joining us today to discuss how the pandemic has disproportionately impacted our patients and our community here in Northeast Calgary. And we also want to take the opportunity to acknowledge the work of our primary care teams and our physicians in response to this pandemic. My name is Nicole Gleason, and I'm the Executive Director of the Mosaic Primary Care Network, and we serve the Northeast and Southeast Calgary. And it's my pleasure to facilitate this discussion today. In the spirit of respect, reciprocity, and truth, it is really important that we start by acknowledging that here in Calgary, we are on the traditional territories of the people of the Treaty 7 region in southern Alberta. This includes the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Stoney Nakoda First Nations, including the Chiniki, Bearspaw, and Wesley First Nations. We also acknowledge that this territory is home to the Métis Nation of Alberta, Region 3, within the historical Northwest Métis homeland. And finally, we acknowledge that all nations, Indigenous and non, who live, work, and play on this land and who honor and celebrate this territory. This sacred gathering place provides us with an opportunity to engage and demonstrate leadership on reconciliation. And we thank your enthusiasm and your commitment to join our team on the lands of Treaty 7 territory.
Thank you, Nicole, and thank you for the welcome. Thank you for the land acknowledgement. I'm reaching you from Ottawa, which is on the traditional territory of the Algonquin people. It is a pleasure to take a few moments with all of you this afternoon. I am getting tired of saying how much I want to get out there and see you all and travel across the country once again. But these Zoom meetings are an opportunity to come together and really say directly thank you to all of you and all the many thousands upon thousands of your colleagues in the healthcare systems in Alberta and across the country who have been working unbelievably hard this past year. During what has been an absolutely exhausting and heartbreaking crisis. It has been a moment where we have seen just moments of tremendous sorrow and loss, but also inspiring moments of people coming together, of communities coming together, of leadership like Naheed Nenshi and George Chahal, who are joining us here today, who've stepped up time and time again for communities they serve. But also primarily all of you as healthcare practitioners, doctors, nurses, people who are there for, in many cases, vulnerable people at extraordinarily vulnerable moments in their lives. This pandemic has been an extraordinarily difficult challenge for everyone, but none more so than all of you who, on top of everything else we're dealing with as individuals, as family members, as community members, have been stepping up on the front lines, helping out, being there for people, and then coming home to care for loved ones, vulnerable elders or kids who you're also worried about and worried that your job might be putting them more at risk, while at the same time you are saving our neighbors and grandparents. Merci pour tout ce que vous faites. Merci surtout pour ce que vous allez continuer de faire. I know the challenge is continuing. In Alberta, we have some of the highest intensity of this third wave, but it's hitting hard across the country. And it's this moment where everyone is absolutely exhausted, sick and tired of COVID, wanting it to be over, not wanting to deal with it anymore. And I have a 13-year-old at home who keeps reminding me of that. Isn't it over yet, Dad? I'm like, yeah, no, not quite. But we feel how close we are getting to it. Vaccines are coming in, increasingly. We should have close to 2 million next week. And then the week after that, it's 2 million Pfizer every week and all the others on top of that. So we are really in an acceleration phase of the vaccination, which of course continues to mean more work for you, but it also means a light at the end of the tunnel. And I have to say that healthcare practitioners across the country, including and especially in Alberta, have been excellent about delivering vaccines. It's an ongoing challenge. And of course, particularly amongst vulnerable populations, we need to be making sure we're giving people confidence, we're encouraging them, time to get vaccinated. We're reaching them where they are and responding to them. But I know that your health network has been extraordinary about being connected and on the ground. I am, as you may have seen, very, very immensely pleased that I just got my my shot this earlier today. So that is a load off of my shoulders. But mostly, it's a sign that I wasn't going to do it until it was my turn, until a lot more people are getting it as well, so I could encourage people to do it. We really feel that it's coming along, but of course, we can't necessarily vaccinate our way out of this third wave in the short term. It's going to continue to demand an awful lot of us as we lean in, as we continue to be there, as we give people confidence, as we help them as they hunker down, particularly the vulnerable, particularly folks who are in essential work. All this together, the federal government has been there. We will continue to be there to support you in ways that we can, to support communities who need the help. But there's lots to talk about. So I just wanted to once again say thank you so much. And I'll turn it back to you, Nicole, to kick off the discussion. Mais je suis très, très content de pouvoir passer quelques moments avec vous pour vous remercier et pour vous entendre. Thank you so much.
Thank you, Prime Minister Trudeau, for those kind words and acknowledgement. And I think you'll hear throughout some of our discussion about those shared experiences that you've already spoken to. And I also want to acknowledge our local representatives. As you mentioned, they have been wonderful supports to us in our collaboration and work to support the pandemic. So Mayor Nenshi, Councilor Chahal, welcome. And on this call, joining me today is some of our dedicated staff, as well as some of our dedicated physician members, and our physician members will really speak to some of their experiences. And I think you'll start to hear themes of, how it's adversely affected our patients and how we've pulled together to demonstrate the critical role that primary care plays in this response, but that we can't do it alone. And that collaboration with our communities to make sure that no patient falls through the crack has been critically important. And then finally, you'll hear some of the great integrated efforts that we've had in the Calgary zone. Again, really trying to pull primary care and some of our specialty colleagues together throughout this. So it's my pleasure to introduce our physician speakers today. And I also want to note that while they all wear multiple hats, they are also primary care physicians in our community currently practicing and supporting their patients through this. So it's my pleasure to introduce Dr. Fiza Rafiq, who's the president of Medical Doctors International, and Dr. Yvonne Kangon. She's our Mosaic Primary Care Network Associate Medical Director. Dr. Annalie Coakley, who is our physician lead at our Mosaic Refugee Health Clinic. And finally, you'll hear from Dr. Ernst Gravenstein, who's our Calgary Zone PCN physician lead. And so to begin our discussion, I will invite Dr. Fiza Rafiq to touch on the great work that Medical Doctors International is doing in her experience as a primary provider.
Good afternoon, everyone. Thank you, Nicole, and thank you, Prime Minister, for your time today. It's an absolute pleasure for me to be here today and discuss and share our journey of MD International during this COVID-19 pandemic. So in March of 2020, at the start of pandemic, we were the first one to create MDI COVID-19 task force with a mandate of creating awareness with webinars on signs, symptoms, mode of transmission, prevention, and isolation. And we provided information in different languages through our local radio stations and live webinars. We conducted weekly MDI health series to keep people active in isolation by involving our local yoga instructors and physiotherapists. And we sent out our recommendations in line with Alberta Health Services policies to community and religious organizations. And we successfully lobbied to stop mass gatherings in mosques as early as in March 2020. As you know, it was Ramadan last year too, and it was hard to convince people during that time. We extended our help to Alberta Health Services and primary care networks in these extraordinary times, and helping people in isolation by joining hands with Canadian Muslim Response Network. So this was during the first wave of COVID-19. In the second wave, MDI started a campaign in November that was I Am a COVID Guardian campaign, and which included four components. The first component was reaching out to different communities by involving different community leaders and community members to share their messages on social media in their own languages. And around 100 videos in over 25 languages have been done. And many people joined this campaign, and Minister of Social Services Rajan Sani joined our campaign, as well as Mayor Naheed Nenshi also supported the campaign. So thank you very much, Mayor Naheed Nenshi, for your support. Involving 90 international medical graduates who are not working here. They are part of our organization. We involve them with Alberta Health Services in contact tracing, and they are a great source in our community who can make strong bridges between different ethnic communities and healthcare providers. And creating awareness about COVID-19 vaccine was a big one. So our scientific and research committee organized free interactive webinar on myths, mysteries, and facts of COVID-19 vaccines, and recently on the variants of concern. And this reached more than 6K people on national and international levels. And we're also collaborating with Northeast Collaborative and local agencies like Action Dignity on vaccine rollout in Alberta. Supporting COVID-19 positive families in their daily needs, we had an initiative with Meals for You. This was an initiative which has healthy, nutritious food prepared by an authentic local restaurant to more than 190 people we have done so far, provided food at their doorsteps. And pre-Ramadan food drive, we did that, and we provided food hampers to 230 families before Ramadan. So we are also providing medical supplies to COVID-19 positive patients in collaboration with Center for Newcomers. So in the end, I would request all of us to become a COVID guardian and protect our families, our communities, our province, and our beautiful Canada. And thank you so much.
Thank you, Fiza. Thank you so much for the initiative, for the leadership, and for really making efforts to connect to people in ways that reassure them. I mean, so much of COVID is scary that if we're making sure and unknown, but if we're making sure that we're connecting with people in ways that are culturally sensitive and language appropriate, it makes a huge difference. So that leadership you've shown has, I know, saved many lives along with your colleagues.
Thank you.
Yes, thank you so much, Dr. Rafiq. It's just, an amazing example, and she's a cherished Mosaic physician member, and just really, really echo your acknowledgement, Prime Minister, of the efforts. And I'd now like to take this opportunity to speak to an extension of our physician medical homes, and we call this our Access Clinic, and it's to support access and continuity and extended services. And we receive daily lists of COVID positive patients, and we ensure that each one of them has follow-up from a primary provider, or that to ensure that their primary provider has the results and can support them throughout their experience. So it's my pleasure to hand it over to Dr. Yvonne Kangon, who will speak to this in more detail.
Thank you, Nicole. And thank you, Prime Minister Trudeau, for your time today. So since March of 2020, the physicians in the Access Clinic have conducted over 2,750 in-person visits and over 8,000 virtual visits. Our nursing and medical office assistant teams, some of whom are on this call today, have also been so important to our response. These teams have conducted over 16,500 COVID positive follow-up cases, supporting the medical officer of health list, which often included patients from workplace outbreaks, such as local meat plants, which Dr. Coakley would speak to. So I'm just going to talk a little bit about my experience with as a physician in the community. Donc, je vais juste une petite réflexion en français. Donc, chaque jour que nous quittions notre domicile, on se demande si on rapportera le COVID-19 à la maison. Comme tout autre Canadien dans le secteur de la santé, cela entraîne beaucoup de stress. Heureusement, nous avons le programme de soutien aux employés ou aux médecins que nous encourageons tout le monde à utiliser ce service. Notre communauté a été le plus touchée parce qu'elle est une zone à faible statut socio-économique avec beaucoup d'immigrants et de réfugiés avec de nombreuses perches sont en charge. La santé mentale, l'obésité et d'autres maladies chroniques sont en hausse. Certains n'ont pas les moyens de payer les médicaments ou de manger 3 repas. Nos équipes ont offert beaucoup d'appui. So moving back, our focus right now is on vaccine hesitancy, and we continue to approach this in collaboration with other community groups to help educate our community and also to advocate for them. I was fortunate to be one of the physicians alongside Minister Rajan Soni and MDI International for their COVID guidance campaign, which was really amazing because we reached so many people in different languages, and also working alongside the Center for Newcomers just to help educate this population. So we really want to say a big thank you to all our staffs at Mosaic who have really been paramount in supporting this response, their dedication, their commitment, and they are really at the heart of our response. So I will now pass it over the baton to Dr. Annalie Copley, who is a physician lead for our refugee clinic, to expand on observations in her work in our communities. Thank you very much.
Merci, Yvonne.
Thank you, Yves. Oh, hey, Prime Minister, the last time we met was actually 1989 at a dinner for one of our mutual friends in Montreal. And
Wow.
what I remember so well about that night is that wore, no, I'm not going there. You wore a cape. And so I was it was a very sort of courageous fashion choice in 1989. And I really appreciated and was impressed by your sartorial style. So anyway, speaking of courage.
Yeah, courage, although one of the first things my wife did when we moved in together was threw out all my capes. So it was, I gave them to the Sally Ann, but yeah. So I don't know what, yeah. Anyway, Annalie, go ahead.
So anyway, so what I just wanted to reflect upon today is first, I need to thank you for some decisions you made early on after your election, and how those decisions in 2016 have actually allowed us to meet the needs of our patients impacted by COVID-19 now. So if you remember, shortly after you were elected, you reversed the cuts to interim federal health. And so when those cuts were made by the previous government in 2012, it had a profound impact on our patients. So many of our patients lost access to health services and health benefits. And so we were unable to provide prenatal care to our pregnant women, cancer care for our patients suffering with cancer. And in fact, we had patients die as a result of their lack of care. And so when you reversed those cuts, it made a huge difference in our patients' lives. And I want to thank you on behalf of the refugee clinic and refugee providers across Canada and the patients we serve. So thank you. The other decision you made early on was the decision to resettle 50,000 Syrian refugees to Canada. And so that was a courageous decision back in 2016 or 2015, 2016, because back at that time, the talk around newcomers was quite negative. You know, we were talking about hotlines and there was a lot of othering of our newcomer communities. And I was quite alarmed. And that decision to offer refuge to 50,000 Syrian families forced to flee their homeland without much hope for their future, except to get into, you know, a boat and cross the Mediterranean and try their luck in Europe. By Canada offering that hand and that welcoming hand to come to Canada, to give them a chance at a future here in Canada. One, it made me proud as a Canadian. And two, what it did with the resettlement of 50,000 Syrian refugees over a short period of time, it really forced an intersectoral collaboration. And so that collaboration has was forged during that time, and it allowed us to meet other challenges moving forward. So it helped us provide that welcoming, like a welcoming community to the Syrians. And then further, it allowed us to welcome other very vulnerable refugees moving forward, like the Yazidi refugees who came to Canada as part of the Victims of Daesh program. And indeed, those collaborations, those partnerships, they allowed us to meet the needs of our most vulnerable newcomers during the COVID-19 pandemic. And so it's the City of Calgary, it's our Board of Education, it's the health sector, and it's our community partners in terms of the newcomer agencies that we work so closely with. And together, I think our partnership came together most significantly during the outbreak at Cargill, and we've actually built on that moving forward to meet the needs of our patients. But meeting the clinical needs and the social needs not only helped those individuals, but it actually helped curb the pandemic. And now moving forward into the future with the vaccination rollout, as Yvonne and others and Dr. Rafiq explained, we're building on those partnerships to provide that outreach and that education so that patients from our newcomer communities can make an informed decision to get the vaccine. And so I just want you to know that those decisions that you made early on are helping us address the pandemic now. And you're, in my mind, not to sound too cheesy, but that cape that you had back in 1989, like in my mind, you've doffed that and you've donned, a metaphorical cape of the hero. So thank you.
Thank you. Thank you very much, Annalie. And those are lovely words. But I think that the thread that runs through each of those examples are two things. First of all, it is as much about Canadians stepping up as any government action by any particular government. On the Syrian refugees, it was communities reaching out saying, what more can we do? And that's what allowed that to happen. It wasn't just government deciding and flipping a switch. It was communities opening up and welcoming. Similarly, the outcry on healthcare for vulnerable refugees was a very clear ask by so many Canadians of a cut that just didn't make sense. But in both of those cases, they're excellent examples of where doing the morally right thing, the nice thing, is also very much the smart thing. And you touched on it as well with the third example of meat plants or vulnerable communities, that providing supports to the most vulnerable is, of course, the right thing to do, but it also gives outsized consequences in terms of public health, in terms of community outcomes. And we're seeing that in each of those examples, that the refugees not having adequate health care is a danger for the larger community, not just a danger for themselves. Welcoming in Syrian refugees is obviously very good and nice for them, but as we've seen over the past 5 years, the contributions to community, to our country, and the way we get to think about ourselves as a country that is open to diversity and willing to lean and learn from each other, not without lots of challenges remaining, is a step in the positive direction. And I think what we've seen during this pandemic has been the story of Canadians being there for each other. Healthcare workers being a primary example of that, but the number of neighbors who've stepped up to be there for their elderly neighbors, or people going into lockdown yet again because they know that's the best way of taking the load off you guys and making sure all of us get through it. That sense of community that articulates itself in so many different ways and is embodied by all of you is really why it is such a privilege for me to be able to contribute and serve this country in the ways that I can. But it is Canadians who drive that, and I just feel so privileged to be able to be part of all this with you.
Yeah, thank you for that, both Dr. Coakley and sharing those experiences and those comments, Prime Minister. I think you just really highlighted for us that, while our patients have and us as providers have never experienced supporting them through a pandemic, the critical, I'd say, success to all of this was that willingness to come together and say, we don't know how yet, but let's get to the table and let's figure it out because our patients are suffering. And you'll see that is the undertone to this entire story, is that we've come across, different sectors come together as a community. And so I just really, can't highlight those words enough. And so then moving into our last speaker, it's Dr. Ernst Gravenstein, who again works in our community as a provider, as a physician provider, but is also our primary care physician, Calgary Zone representative. And he's going to speak a little bit more in detail about how we've come together in the Calgary Zone to support the pandemic.
Thank you, Nicole. And Prime Minister Trudeau, I'm also filled with hope because I also got my vaccination this week. And I think what I'm hearing from our conversations here today is, I think there's a glimmer of hope. And I am so encouraged by all the different stories around this table. And what's more Canadian than this? And this is what's giving me more hope even than the vaccination, is how we can overcome some of the burdens that we are facing at the moment together as Canadians. These inspiring local initiatives that you've heard about from the Mosaic PCN are supported by a unique zonal strategy. Our 7 local primary care networks worked collaboratively with public health to create a single access point for all patients that tested positive for COVID-19 but did not require hospital care, creating a trial and a tested safety net for all our patients with COVID-19. Most COVID-19 patients do not require hospital care, but in many jurisdictions, patients with mild and moderate symptoms flood local hospitals and creating a huge pressure on the system, beds, as well as staffing and resources. In our strategy, patients are triaged, are either treated or connected with their family doctor or clinic, and unattached patients are cared for while we support them to find a family physician. This plan harnessed the power of primary care, which in the Calgary Zone includes more than 1,700 primary care physicians and over 400 healthcare professionals caring for 1.5 million Albertans. The Calgary Zone developed tools to support family doctors to care for their patients in the community, including a popular COVID-19 tele-advice line for physicians, a COVID-19 care pathway for both adults and for pediatric patients to safely care for patients virtually in the community, and peer-to-peer webinars, which all have since been scaled provincially. This resulted in 96% of all patients with a COVID-19 diagnosis being treated in the community, freeing up vital hospital beds for the critically ill, accounting for the lowest hospital admission rate in the province. The next step in our strategy, as mentioned previously, is vaccination of all Albertans wherever they can access that care, in their community family physician offices, through pharmacy, all through Alberta Health Services, as well as education and tackling vaccine hesitancy. Now, through this story and through the stories that you've heard, it's very evident that primary care has been and continues to be the foundation to support our healthcare system, and especially in COVID-19. The management of patients and the stories that you've heard here is exemplary. And I'm so proud to be, first of all, Calgarian, and second of all, Canadian, because that fills me with the hope that I've been talking about earlier on. Thank you for this opportunity, and I wish with you that we are past this, and it is with the efforts that we are putting in that we are going to see an end to this in the near future. Thank you, Nicole.
Thank you, Ernst. I think it's really so important to pause and to learn, and I'm glad to hear how a number of your initiatives have been scaled up across the province, and certainly initiatives like that we've seen developed across the country. I think so much of our healthcare system over the past decades got anchored in institutions, and whether it was bringing someone into the hospital and the idea of physicians or even care being delivered in and within and grounded in community was not the model we went into. And obviously the federal government doesn't have a direct role in delivery of healthcare, but there is no question that as we move forward through this experience, that reflection on how to better serve and support people where they are, where they live, so you're not removing them out of the community to put them in an institution, is not just a better sort of quality of experience, whether you talk about seniors aging at home or someone who can get community services as opposed to having to go to the hospital across town. These are things that are better for quality of life, better for the support systems around, but also a more efficient use of resources in terms of delivering efficient supportive care that really focuses on what people needs and is not clogging up, as you say, our emergency rooms with people who don't have access to primary care physicians or supports in the community. So one of the things that is obvious is that as we move through this pandemic, it is not going to transform directly our healthcare systems on its own. These are all trend lines that I think we've seen coming over the past decade or so that have just been significantly accelerated by the stressor and by the pressure and by the urgency and exigencies of this pandemic. But the ability to leapfrog forward, the ability to draw on what works, the ability to really listen and understand on how caring for the most vulnerable and supporting them in ways that are present and not distant is essential. And a big piece of it as well is the same way, so many people are becoming amateur epidemiologists by watching the news and websites all the time. People, I think, are very aware of the things they can do to contribute to their own health. And of course, a very narrow band around COVID right now, but I think there is an understanding that we all have a role in contributing to our well-being, and a community and a society that focuses on delivering both the information and the tools for people to be better and to, stay above that healthy line is so important. So I'm really, really excited to hear the innovations that you've all brought forward on community and grounded care. One of the commitments we made in 2019 was to help people access primary care physicians all across the country, and there was a big resistance to the idea that, oh no, you could somehow access your primary care physician through video conference. Nobody would have signed up for that at the end of 2019. I think people are understanding that there is an efficiency and a connection there. In many cases, that's all it can take, and that frees up time to be able to spend more energy and resources on those who are in need of more intervention. And that careful and smart use of resources, that's just a small example. Obviously, every province across the country will have its approach on what the right mix is, but I can tell you that the federal government will continue to be there, not just to support, as we have with billions of dollars to the provinces for immediate supports to healthcare systems, but also as we look to the future of healthcare, we know there's going to be a need for more funding, but there's also going to be a need for innovative thinking and the kinds of leadership that it's no surprise to me, but that Albertans are showing on this is inspiring and, quite frankly, exciting.
Yeah, thank you for those comments, Dr. Gravenstein and Prime Minister. And I think I've really appreciated that optimism and that message of hope, and agree with you in saying that sometimes, these circumstances can bring us together and, help us, assist us in looking at how we can work better together and in different and innovative ways. And, we do hope that that continues post this pandemic. And so that's kind of ends our formal presentations to you. And we really open it up and welcome your questions to us, and we can further kind of share our experiences.
I guess to kick things off, and I want to hear from you, and if ever you have any questions for me as well. But I mean, this has been a time of tremendous heartbreak and tragedy and challenges and exhaustion and all sorts of very difficult moments. But at the same time, as I've heard, people have been adjusting, adapting, learning new things, looking for silver linings, looking for ways we can move forward in a positive way through these terrible experiences. I'd love to hear some of the things that various numbers of you have responded to or innovated or thought about how we can do things better or different, and where maybe this is a cause for optimism amongst the tiers as we transform our communities.
Yeah, that's a great question. And I think probably any one of our providers could provide some great examples of that. And
let's see a show of hands. Who's going to be brave enough to kick in first?
I wonder if maybe I'll put Larissa, she's one of our dedicated primary care managers. And, to your point, there has been tears shed. There has been some heartbreaking moments, but there has been, I have witnessed everyone on this call and in our organization, in our community, continue to show up. And Larissa exemplifies that in her everyday work. But I think she can speak to literally how some of us have been working to draw the new processes on, the whiteboard and continue to evolve them every day. But, I welcome you, Larissa, to share some of your experiences.
Well, to be quite honest, first of all, thank you for the opportunity to speak with you today. And on behalf of all the team here at Mosaic, especially the nurses and pharmacists whom I support, I'd be in big trouble if I didn't give a big thank you and hello on their behalf. So I'd like to start with that. But, we've created a lot of things at the beginning on the fly. And just, processes, building the plane as we fly it, so to speak. I think we're in a much better position now. But if I look back, I think what I see is one of the big successes, and what I see in terms of process that really, really worked is it's really about the collaboration that everybody has spoken to so far. So, at a very individual and intimate team level, and then moving forward, across the organization, the PCNs collaborating together, our external partners, community, Alberta Health Services. If there's been any process that has worked, it is exactly that continued collaboration and moving, just the less fragmented care forward in a much more positive and collaborative way. So although we created a lot of that on the fly, I think it's opened opportunity for us to really continue to work together, with all of those partners. So.
Thank you, Larissa. I see Annalie has her hand up. I'm worried about. I'm thinking back, 1989. I was like 17 years old in grade 11. So I don't know that I was even that big on dinner parties at that point. So I'm terrified what you might come up with. But you put your hand up, and it's Zoom.
I'm not going to bring anything up. So I just wanted to reiterate, I think what this pandemic has shown, we've always known how the social determinants impact health of our patients, right? Especially our racialized, more vulnerable patients. And this pandemic has really highlighted that. And so that marrying of the clinical care with the social care, and in the world of the Mosaic PCN, we work very collaboratively, always have, with our resettlement partners. So Calgary Catholic Immigration Society, Action Dignity, MGA, Center for Newcomers, et cetera. And together, we've really found ways of working quite closely together to mitigate the needs. And we've seen that we actually need each other. You can't do one without the other. And so just one little example is, within one of our refugee communities, there was an outbreak, and that outbreak was a little bit too, public health didn't have the capacity to manage it. And so we got together with CCIS. We took out our bus, our medical bus down communities. We swabbed all of them, did that screening, connected with those families who were positive, provided a lot of that education and the social support. CCIS provided, the food support, the income support, anything they needed to meet their social needs. And then we at Mosaic Refugee Health Clinic, we met all of their clinical needs. And together we were able to curb or limit that particular outbreak. And so I just think that is what we need to continue forward. We need greater collaboration between the two different sectors. And so that's my silver lining from the pandemic.
I want to give a chance to Naheed and George to weigh in at the end, but they're politicians like me, so they'll speak the whole time. I'd love to give an opportunity to a couple of others to share their thoughts, questions for me, or anything else as well.
Yeah, we have the medical director of the Mosaic Primary Care Network, Dr. Oliver David, joining us on the call as well. So I'll put him on the spot to share from his perspective. And he's been with the PCN for over 10 years. So he's really seen us evolve and mature as an organization. And his leadership has really helped support us throughout this time too.
Great. Thanks, Nicole. And thank you, Prime Minister, for giving me the opportunity to speak. This has been transformational, and I wear a second hat for specialty integration for the for the Calgary zone, and there was a lot of reticence about doing something simple by giving other physicians advice. And with the pandemic, we had expanded the opportunity for advice, from 27 different specialties that we're giving advice to 55 that are currently able to give advice to keep people in their medical homes so that they can receive the care in a very timely manner. This has really been a lot about connection and community, and our teams in the background have done some amazing work. They've been able to connect with people, provide them reassurance, support their medical homes, and it's been, very heartwarming in the whole process. Certainly, as you reflect on these opportunities, you think about, boy, it would be really cool if we could have one joint single medical record where when patients touch anywhere in the healthcare system, someone else knows about it. So that would be a great opportunity at some point in the future that we're hopefully working towards. Really does as well. It really, highlights every person is important in the team, and every person from the MOA to our nurses that have been supporting the transitions of patients back to the medical homes or connecting them with medical homes has been, amazing. They've done such amazing work. Really, as a, physician, I've been out working for 28 years. I was burnt out and exhausted before primary care networks came along. It revitalized, the opportunity, and it made it easier to continue to work and take care of patients. Certainly, we really, and I'm going to quote Nicole because she mentioned it already. We've learned so much about being, we're together, we can do so much. And hopefully we'll continue to do so much as community, as a province and as a country.
Well, thank you, Oliver. And quite frankly, what you mentioned about data and records, there is so much work to do to even just get, even respecting all the provincial autonomy, getting all the provinces to manage and collect their data in a consistent way so we can draw on a national picture at a time of emergency, but also just in terms of understanding and optimizing what's going on is a huge conversation we need to be having in the coming days, because the lack of good data, the lack of disaggregated data, the lack of timely data across the country has been a real challenge. And even within provincial jurisdictions, the segmentation from one health sector to the next, or one region to the next, has caused greater or lesser challenges in different parts of the country. So there's a huge amount of work to do on that. I see 3 more hands coming up, so I will stop talking and listen. Nicole, maybe we can start with Naheed, because you haven't spoken yet, and then we'll go to Afiza and Ernst.
Naheed, are you there? Would you like to speak
Hi,
first?
thank you. Thank you very much, and good afternoon to everybody and Prime Minister.
Yeah, we hear you. Go ahead.
Hello.
Yeah, we hear you.
Oh yeah. So thank you very much. Hello. Thank you very much. Thank you, Mr. Prime Minister. My name is Naheed Rafiq. I'm also family physician, and I wear 2 hats. One is I'm vice chair of Mosaic Primary Care Network, and second is I'm chair of board of trustees of MD International. So I'll definitely echo Oliver's points. Primary Care Network is a blessing. So especially for COVID times, I think it helped us immensely. There was no primary care network, so it was very difficult for physicians, very difficult for healthcare system. And secondly, I wanted to point out from MD International's perspective, and also integrating with the primary care network, it's very, very important to bring communities together. When this second wave started with our slogan campaign, I'm COVID Guardian. So we brought different communities together. We had different roundtable meetings with Pakistani community, Arab communities, African communities, Filipinos, and Bangladeshi communities. We brought them together. Our plan was to bring them together, to get their needs, and involve them in the care of their own communities, to identify what are the gaps, where we can help. And it was quite successful. And that's what I want to say. This model was great. And one more thing, regarding international medical graduates, we have throughout Canada, it's a huge resource who are not integrated into our system at present. But there's a huge resource which can be brought together, trained, or utilized. It's a big resource, Prime Minister, that can be somehow addressed. That will be my last point. Thank you.
Thank you. Fiza.
Thank you so much for all this opportunity today and talk on behalf of our communities here. Like, I am working in Northeast Calgary in an area which is overly populated by all the immigrants from across the world. And it's been an experience for me for the last 15 years working with those communities. But since this pandemic hit us very hard last year, I found there was a big need to communicate with these communities in their own languages. So I was president of MD International at that time, and I'm a proud member of Mosaic PCN as well. It's all about Mosaic. We're all like mostly international medical graduates working here as well, and we know what are the problems communities are facing here. So with our campaign, we got involved, as Dr. Zahid said, that we got involved with Minister Rajan Sani. She's Minister of Social Services. So she joined our campaign and she invited us to be part of this campaign. And she involved me to join these roundtable meetings with all these communities from across the world. Like, as Dr. Zahid said, it was Arab community, it was Muslim community, it was Filipino communities and Africans. And it was so heartwarming to listen to these people and to learn about their challenges. Like, I was almost crying almost every day, end of the day, like, people are going through a lot. They're going through a lot. We think that we have provided them the information, but still we have not reached them according to their own ethnic and cultural and religious needs. So there's lots of work that needs to be done. And I think it's a great thing that we're all together here. Mosaic Primary Care Network is doing a great work, and primary physicians play an important and integral role in lives of their patients. And this is very important to keep this alive and keep the communities together and keeping their family doctors and their medical homes alive and intact to be involved in the care of patients and communities. So I think this is my message for today. Thank you so much.
Thank you, Fiza. Ernst, and then we'll end with Nikki before we go to George and Naheed.
Thank you, Prime Minister Trudeau. I think I just want to echo what has been said already in regards to the value of primary care networks in this situation. Without primary care networks, we would have been 450 to 500 individual practices isolated from each other and really disjointed. Primary care networks have brought us together, finding local solutions for local problems. But then as a zone, we came together, finding common solutions for common problems. And COVID is common to us all. And without that opportunity provided by primary care networks in our relationship with Alberta Health Services, as well as the Ministry for our funding, it would have been a really different picture that you would have seen in Alberta up to now. So I just want to echo whatever has been said.
Thank you, Ernst. Nikki.
Hi, good afternoon. I'm Nikki Panish. I'm the board chair of Mosaic PCN, have been so for the past 6 years. And it's really been my pleasure to watch our PCN grow into the wonderful entity that you're hearing about today. I wanted to take a moment and just thank the membership formally in this very public way to say, thank you for your work. All of you matter. You've saved lives and you've made a real difference. I think you've heard about the growth and the partnerships and the collaboration that we've made with our specialist colleagues and in the patient's medical home. So one of the core tenets of primary care networks is to put the patient in their center of their care. And I think we've really built some momentum with this pandemic. We've capitalized on it, and I'm excited for what we can do in the future. We are going to need additional funding. We are going to need, to integrate technology into being able to do that. And I challenge my colleagues across the country to step up and to continue to build patient-centered medical homes and to put the patients at the center of care.
Thank you so much, Nikki. What the great way to wrap this up. But I will turn now to the local experts, George and then Naheed. Except you're on mute, George, because this is Zoom. And if we're not saying that once a call, we're not doing it right.
Thank you, Prime Minister. Somebody has to do it every meeting, and I thought it would be me today. Well, first of all, Prime Minister, welcome and thank you for joining us today virtually in Northeast Calgary. East Calgary has been disproportionately affected, as discussed today, by COVID-19, and we have had a great support from our healthcare providers, such as Mosaic Primary Care, and the East Calgary Zone Partnership, which is a collaborative of 17 organizations supporting Calgarians in need. I just want to touch on one comment Dr. Rafiq made. The Upper Northeast and Ward 5, the communities I represent, English and French for 2/3 of our residents is not their first language. So from a communication standpoint, that can be quite challenging, as we've seen during this pandemic. And to support the work of your government and to inform Calgarians, our office embarked on a communications campaign. And I know Dr. Rafiq did a video with us as well to support that. And we hosted a COVID-19 vaccination town hall to dispel myths and talk about the importance of getting vaccinated. And I want to thank Mayor Nenshi for his leadership and support with our CIMA chief, Sue Henry, for supporting our town hall, and Dr. Coakley from Mosaic, who's here today, and other doctors, community leaders, and as well as Minister Anand for her important message and the briefing that was provided to the thousands of Calgarians who tuned in. I want to personally thank you on the behalf of my constituents and Calgarians for your leadership and government support in your diversified approach in getting Canadians vaccines and extension of the federal COVID relief programs. I know many of my constituents, and many Calgarians are in need of those wage and rent subsidies, and also recovery and caregiving benefits that were recently extended in this year's budget. So thank you so much for supporting so many in need.
Thanks, George. I mean, one of the things that we just do as Canadians is try to be there for each other, but the federal government always seems so very far away from people that in moments of crisis like this, where we're actually able to be there and support people directly, I think it does a lot, not just for helping put food on the table, but reassuring people that our institutions work and that our country works and that we're all there to support each other, and therefore give them the confidence to actually follow public health guidelines and public instructions on keeping them safe, because they know they're part of a system that is functioning and can give them confidence. So it all feeds in together from the local leadership level that you've demonstrated to all of us way over in Ottawa. Happy to turn now to my friend Naheed for a few reflections. It's great to see you.
Well, merci, Premier Ministre, merci pour ça. Ce sera une journée inoubliable pour nous tous ici au nord-est du Calgary. You've heard me talk a lot, Prime Minister, about how much I love this city and how passionate I am about it, but I'm not sure I've really ever talked to you about how much I love my neighborhood. I am a proud Northeast Calgary boy. I'm sitting here in my fully equipped home studio, which is also my dining room because no one's coming for dinner, here in Northeast Calgary, where I was raised and where I would never live anywhere else. It's a great place. It's a place that has served as a beacon of hope and welcome for people from every corner of this broken earth for so very long. Prime Minister, it's been a tough place this year. There have been many points during the year where the infection rates here in Northeast Calgary were higher than any country in the world. There's no one in my neighborhood who doesn't personally know someone who has died of COVID-19. I'm up to about a dozen now. And that's because the folks who live and work here, my neighbors, are doing important work. They're on the front lines of the food supply chain. They're on the front lines of healthcare. They work in long-term care homes. They're my colleagues at the City of Calgary who drive buses and look after our trash. They're our first responders. And they put themselves at risk. They put their bodies at risk to keep our community going. And that's something that's sobering for me every day. And when we think about the politics around COVID-19 and all of that, none of that matters to me one bit. What matters to me is the gratitude I've got for my neighbors and the gratitude that really fills me with the need to just keep saving lives. So on this sunny spring afternoon here in Calgary, I'm going to be grateful. I'm going to be grateful that I get to live in this country, that we've all come here to this country to live lives of dignity and prosperity and opportunity. I'm grateful for you. I'm grateful for you and your leadership. I'm grateful that your government has looked after people in these difficult times and has made sure that they can keep food on the table and made sure that they have a glimmer of hope in all this work. I'm grateful for Mrs. Trudeau and you today for doing the single most important thing you can do for public health. Get your shot. I'm a week ahead of you. Usually I'm 6 weeks behind the Prime Minister because he's 6 weeks older than I am. But today I'm a week ahead of you, and I got to tell you, nothing, no sore arm, nothing. So I want to hear about your side effects, and you're much fitter than I am. So I wish you goodness there. I'm grateful for our local leadership. I'm grateful that I get to live in a neighborhood represented by Councilor Chahal and the incredible things he has done tirelessly within this community. I'm grateful for Calgary Emergency Management led by Chief Susan Henry and her team and everything they've done. Right now, they're just making vaccine lineups go fast during this crazy state of local emergency. I'm grateful mostly, though, for the women and men in our healthcare system. From our Chief Medical Officer of Health, Dr. Gina Hinshaw, to the women and men that you've had the chance to meet today, and all of the people who stand behind them in this primary care network here in this neighborhood. They're doing unbelievable work under unbelievably difficult circumstances. I'm grateful for the social service agencies that have come together. You heard from George about the Calgary East Zone Newcomers Collaborative, who is kind of our arm for providing social services help during COVID, not just to newcomers, but to everyone, whether it's emergency food relief, overcoming myths and misinformation, or helping people get comfortable in their own language about all of this. And, as I sort of step down from public life soon, that's what I'm going to remember. I hope that we never forget the bad parts of this year, but I hope that we never forget the extraordinary parts of this year and how people came together to look after one another. So it means a lot to us all that you're here with us today. And I just want to say thank you for being here with us today. Thank you for hearing our stories, and keep us in mind as you continue to make those important decisions. Every single one of us has you in our corner.
Thank you so much, Naheed. I'll turn it back to you, Nicole, for closing remarks, and then I'll wrap it up.
Thank you so much. And honestly, I think I have nothing left to say. You heard it right from our people. And I think as a leader, the most strategic advantage is your people. And I really want to just say thank you for taking the time to speak with us and letting us share our story with you. And really appreciate that message of optimism and hope. Thank you, Mayor Nenshi. Really appreciate that as well. And so I just know and I believe that together we can get through this final wave. So thank you so much for being with us today.
Thank you, Nicole, and thank you, everyone. I hate speaking after Naheed because he always leads with his heart in a way that leaves me struggling to match it. So I won't say much more because so much has been said, mostly by all of you. I just want to say thank you. This has been a year that we will all want to forget, but we will all instead be remembering and living with, and drawing inspiration and strength and depth from for the rest of our lives. And we will get through this, thanks in large part to all of you. And so many of the people you directly serve who are vulnerable and all too often don't have the voices that need to resonate quite loudly enough. And that is what you are doing. Keep it up. It's been a privilege for me to be able to spend a little time with you on this beautiful early evening in Ottawa. It sounds like it's a beautiful day in Calgary as well. So wishing you all the best. And really, I am so looking forward to seeing you all sometime soon, because that means we can all start traveling again and we're through this. And it'll just be nice to be able to get out there and shake some hands and hug people when the time comes. I think we've all learned so much about ourselves and about community and about what really matters through this difficult moment. I just know that we're going to need to work very, very hard as leaders in our communities, in our systems, to make sure that we are truly internalizing and living up to the lessons that we've all learned together at such costs for through these past 12 months. Lots more to do. But I am every day inspired by extraordinary people like all of you. Merci d'avoir pris le temps pour moi cet après-midi. Je sais que vous avez énormément à faire, mais ça me touche énormément et j'ai bien hâte de continuer la conversation de toutes sortes de différentes façons dans les années à venir. I look forward to continuing this conversation in the years to come with all of you as we continue working to build a better future for everyone. Merci beaucoup, mes chers amis. Thank you so much. Have a great night and have a great weekend, but a safe weekend mostly.